Hello, Freely Health. We are Team 1, the Infomasters, and this is our final presentation. The Infomasters are comprised of Jonathan Carter, Devin DeRoe, Kiana Madge, Kyle Tran, and Selena Turner, and we are all very excited to share our ideas with you. Our agenda in this presentation is a brief team introduction, an overview of your business and the opportunities that we see for you, our approach and methodology, our implementation options, and finally, our recommendations. And now, a brief introduction to our team. Jonathan Carter earned a BFA in film production and has over 5 years of experience in healthcare coordination. Devin DeRoe has a BS in hospitality administration and currently works for the world's largest medical device company. Kiana Madge has a bachelor's degree in economics and plans to start her own custom jewelry company. Selena Turner has a BS in tourism, conventions, and event management and has experience working in executive support across 5 sectors including healthcare, pharma, education, nonprofit, and tech. Kyle Tran has a BS in civil engineering and currently manages 2 renewable energy projects that are worth over a total of $300 million. That's our team, and now let's move on to our ideas.
Our traditional model shows what would be expected of a traditional therapy. There are models of in person therapy which is not accessible to everyone, limited access to certain therapy providers, one on one treatments, and a public interaction or limited privacy which many do not feel comfortable with. The new model we have shows therapy via smartphones, making it accessible to everyone, expanded access to providers wherever you are, connecting people, and most importantly, having an anonymous interaction and almost total privacy, which many people enjoy and prefer. For our attracting therapist model, a challenge that is faced that we want to approach is attracting therapists and partnering with universities to allow therapy students to earn licensing hours with Freely while also providing their services for people using the app. We want to create an incentivization strategy that helps retain all the current listeners and therapists we have, but also attracting new talkers on a regular basis. For our therapist pricing strategy, we want to increase the profit margin by having a new pricing structure for both the therapists and the people holding the subscriptions. Lastly, we want to explore the process of implementation of a blockchain technology that allows for newer innovation for freely while using the application. When building our model to attract therapists, we organized our strategy based on the needs freely communicated to us. We started by researching how best to attract therapists and therapy students. We then established target groups to investigate and began exploring which technology platforms we think can benefit Freely the most in reaching out to these targets, including various kinds of social media advertising. We then researched on how technology can be used to improve the efficiency of the application and the user talker relationship. To validate our findings, we will track how many new therapists sign up as a result of our marketing efforts by creating a marketing campaign, while also examining statistics on the rates of certain mental health disorders in targeted communities as they become available. Ultimately, we want to understand our findings and craft our solutions to create a cost savings plan to implement changes that can impact Freely in a very successful way, not only for the company, but for the therapist and the users using the app.
The goals of the Attracting Therapists model are to attract over 5,000 new therapists to Freely in less than 1 year, to verify the legality of employing student therapists, and to enable student therapists to earn licensing hours through Freely. In order to implement these strategies, Freely will need to leverage social media advertising on TikTok, Indeed, and Google in order to recruit therapists, to target underserved communities by promoting Freely to communities with higher than average rates of mental health problems to demonstrate the positive impact Freely can have on a community, to contract an attorney to investigate the legal issues surrounding the app, and to create a business development agent to partner with educational and psychological networks to enable student therapists working with Freely to get hours toward licensing and possibly course credit. Implementation costs are as follows: $288 to buy ads on Indeed to run for 12 months at $24 a month, $30,000 to Google AdWords to generate 30,000 clicks at $1 per click, $200 to TikTok to generate 200,000 views with a rate of $10 for every 10,000 views. Total annual investment is $40,000 per year. The cost of targeting an underserved community is estimated to be roughly $2,000. This is effectively the cost of using a Freely employee to identify communities with higher than average rates of mental health issues and to use public records and any other available data to determine how much rates of mental health problems fell when Freely's service is offered to people in those areas. We estimate this will take roughly 20 hours with an internal billing rate of $100 per hour. The implementation costs of contracting an attorney to investigate the legal issues of the app, including the ability to use student therapists to provide Freely's services, are estimated to be approximately $10,000, assuming a billing rate of $250 an hour over the course of 20 hours. The implementation costs of creating a business development agent to contract with Freely for 3 months are estimated to be $67,000 at a rate of $100 per hour over the course of 667 hours. Now I'm going to hand off the presentation to Selena, who's going to talk to you about the incentivization model.
Thanks, Jonathan. So, as we've said before, providing incentives to encourage and reward stakeholders sends a powerful, affirming message of positive acknowledgement and recognition. In this case, it can also send a powerful message to therapists and even listeners about the performance you'd like to see from them. Used effectively, our model can help build motivation and engagement, which is a win win for everyone. People want to be a part of something bigger than themselves, and Freely can definitely provide that. Incentives are a great tool for all those involved with Freely while fostering the organization's success. So, how did we develop our model? We evaluated what types of behaviors Freely wanted to reward based on things they have communicated, including their core values. And at the end of the day, those are focused around creating a very safe space when it comes to mental health for everyone, therapists, listeners, and talkers alike. We chose 3 different incentivization categories: compensation, recognition, and reward, all of which I'll break down further in just a moment. And of course, we wanted to be sure the incentives that will be offered are cost effective while maximizing opportunity. Validation of the incentivization model is going to rely heavily on data. So, determining top contributors by tracking performance of listeners and therapists. And what that can look like is individual patient attendance, as well as retention rates of the therapist's caseload, with a huge focus on retention. Tracking the attendance of talkers. How often and when are they logging on? And determining how many therapists, listeners, and talkers join Freely as a result of the incentivization model itself. And this could be done by something as simple as consistent surveying of stakeholders. When it comes to the incentivization strategy, we want to socialize findings and propose solutions for things that are not being done well, things that may need a little tweaking or improvement, but also highlight things that are being done well so that they can be continued. And then this is not meant to eat an entire budget. So we do want to keep costs low while maximizing these great opportunities. And then the last thing is to implement a personalized dashboard. And I'll get more into that on the next slide. With this model, we've broken incentivization down into 3 main categories: compensation, recognition, and reward incentives. So let's start with therapists. We suggest performance-related bonuses and a professional development stipend. The bonus would be based on individual patient attendance as well as a potential additional cash bonus determined by quarterly retention rates of the therapist's caseload. And then with professional development, we recommend including a stipend to be included that can be used for continuing education credits after being employed with Freely for 1 calendar year at minimum. Offering professional development as an incentive will inspire employees to build tenure with Freely and their patients while receiving opportunities needed to do even better work. The second incentive suggestion is for the listeners, and this includes recognition. Oftentimes, employees just want to be recognized for the good work that they do. While providing well deserved recognition, this kind of incentive program also rewards employees for appreciating and caring for one another while providing key benefits. And these include enhanced retention, boosted morale, and useful collaboration. While training and regular feedback is imperative to the longevity of the listener's volunteer work within Freely, of course, we also recommend implementing a kudo board and feel good story of the day. So, on the previous slide, when I talked about this personalized dashboard, this is when it would come into play. When you log on to the Freely app, listeners would be able to see their kudo board. And this is what their talkers and therapists and other listeners are saying about them. And this is like a virtual bulletin board, if you will, of individualized and unique messages and gifts and photos and comments for the lucky listener. Kudo Board is the perfect way to celebrate Freely's listeners' hard work and show the company's appreciation for them, keeping them engaged and supported throughout this whole entire process. And then lastly, our third incentive is for talkers, including a reward incentive. So, given the favored suggestion from the pricing proposal that Kyle will be talking about, we recommend implementing a point system for free sessions to offset an increased pricing structure. So talkers will have this virtual smile punch card, if you will, and their attendance along with adherence to therapy are monetarily rewarded. And what we mean by this is that with each daily check-in for therapy, a half point will be given, and then another half point can be earned through active community engagement, such as the kudo board. For every 1 point, a hole gets punched in the smile punch card, and every 5 punches will earn one free session. This incentive will allow Freely to reward their talkers for active engagement and treatment, and we believe it is a super powerful tool in improving clinical outcomes. So, tying this all together, again, this personalized dashboard, when a therapist, listener, or talker log into the Freely app, they will get to see all the different data and metrics, opportunities, etc. So for therapists, they'll be able to see an overview of their performance. For the listeners, you're going to see your kudo board and a feel-good story of the day. And then for the talkers, you're going to see your punch card and anything that you post within the community, such as a GIF on a kudo board. Now over to Kyle to discuss pricing strategy. Kyle?
Therapist pricing strategy, approach, and methodology. To optimize the professional service pricing, first we evaluated Freely's financial model to identify the services that has the highest profit margins. Our analysis shows that the bronze subscription package has the highest margin of $105. Meanwhile, the silver package and the pay per session have similar profit of about $30 per session. Once we identified the top profit margin services, we created 3 pricing options and ran them in the financial models to compare and select the most profitable option. Among the 3 options, the simplest option, aka option 3, happens to yield the highest profit margin and has the most profit for the next 5 years. The goal for therapist pricing strategy is to optimize the pricing structure and increase the total net profit by at least 20% by the year of 2026. The InfoMasters believe that we have found a feasible solution, which we'll be more than happy to go into on the next slide. Option 3 is the simplest and only contain 2 services, unlimited messaging and pay per session. The option 3 financial model shows a 11% to 15% uplift for the monthly profit margin when compared to Freely's original pricing structure. The model also shows an increase of total $15 million in profit for the next 5 years. The InfoMasters also explored the applications and feasibility of blockchain technology. We also conducted an extensive research to identify the implementation costs for the 2 options. The 2 options we identify are 1. Freely can create a native token, or Freely can use an existing blockchain platform. Now, for the second option, the InfoMaster created a short list of blockchain platforms and we compare their applications. Lastly, with all the information we gather, the InfoMaster will provide the most cost-effective recommendation that best fit Freely's need. Our research concluded that the native token option is not financially feasible at this stage. At a staggering price point of $1.5 million, an investment in a native token is viewed as less favorable than white labeling Fort Knoxers into Freely services for a monthly or an annual cost.
We hope that our presentation has sparked interest in making impactful changes and have these final recommendations. First, for attracting therapists, these are the 4 recommendations that we will be recommending. First, we want to leverage social media to get the best therapists for the application. Secondly, we want to target underserved communities that are in need of the best therapists to help them with any struggles they face or have around them. Third, hire an attorney to help with the legalities of the app and the user-talk relationships. And lastly, we want to create a role of business development agent or business development executive to help partner with educational and psychiatric networks. To incentivize talkers, we recommend compensation, recognition, and reward incentives. For incentivizing talkers, we want to make sure that we're sparking their interests with certain incentives. So whether that be to give school credit, monetary or non-monetary bonuses, specific point systems, or just a feel-good story of the day, we want to make sure that they feel rewarded for all of the hard work they're putting into the app for Freely. Third, for our therapist pricing recommendation, we suggest adopting a pricing structure that will allow Freely to have a better way to make sure users and talkers know how the pricing works, but by also increasing Freely's profit by $15 million by 2026. And lastly, to implement blockchain, we want to see if there is a possibility of white labeling using Fort Knoxter or utilizing another blockchain platform technology in hopes to make the Freely application more innovative by having better technologies. And that brings us to the end of our presentation. I'd like to summarize by saying that the potential effects and benefits of mental health applications such as Freely are enormous. The sheer number of patients Freely will reach is unmatched in traditional healthcare. The patients will have 24/7 access to care, allowing them to apply certain therapeutic principles between sessions, and the data we have gathered during our research has been proven invaluable. Freely will be able to take the burden off of traditional providers within the traditional mental health care space, as many providers face increased mental health care demands. Now I'd be happy to open up the discussion if anyone has any questions. Thank you.